We have some messages. The positive impacts of Medic Bleep, an asynchronous communication platform, versus existing communication methods and observational study. My name is Meenakshi Jhala. I am a medical student at St. George's University of London, and today I will be presenting our poster presentation to you. Our healthcare system is very dependent on synchronous and asynchronous communication. Synchronous meaning any in-person and telephone communication, and asynchronous meaning pages, bleeps, emails, and patient notes. However, there are many risks associated with synchronous communication, such as clinical errors, inefficient workflow, time and monetary costs. And not only is there impact on patients, but staff also experience the detrimental impacts as well, such as burnout, stress, and mental health issues, which could be down to the methods of communication. Therefore, this then has an impact on workflow integrity, service delivery, and medical care. And why is this an issue? Well, the current pandemic of coronavirus has shown how important it is to have an efficient healthcare system in place to provide quick and holistic patient care. And therefore, what we did is that we compared traditional synchronous communication methods to an asynchronous communication platform known as Medic Bleep, and also observed what its impacts were on clinical workflow, quality of work life, patient safety, and hospital core operations. So we carried out a time and motion study, which basically analysed work efficiency through observation and timing of tasks. In particular, the time studies included direct and continuous observation of given tasks, and the motion studies looked at work motion in order to analyse workflow and establish the best practice. Healthcare professionals were followed from 3 separate wards over a period of 2 weeks, using both forms of communication to allow for comparison. And for qualitative analysis, we also sent out questionnaires and conducted interviews to identify views on the platforms. So what did our results show? So we identified over 40 hours of communication, and it was found through our quantitative analysis that asynchronous communication saved on average 20.1 minutes in mean task completion, which when compared to synchronous communication was a saving of 58.8%. And this was statistically significant in various categories. So for example, this table shows that for doctors, nurses, midwives, TTOs, patient reviews, discharge and patient transfer, most of the p-values are less than 0.05. So this is all statistically significant. And the qualitative analysis also showed that there was an increase in 24% of staff that found that asynchronous communication allowed for faster completion of discharge management plans, and 67% found easy implementation. And lastly, 87% showed a high appetite to replace the traditional synchronous communication method with asynchronous methods. So why is this important? Well, we know that 1 billion calls are made internally in NHS trusts per year, and from this, approximately 320 million are unanswered. Now, being part of the NHS myself, I know that each and every call is significant in healthcare and can be a matter of life and death. Therefore, using asynchronous methods can or might be able to eliminate this, and other research also reinforces this. So, for example, research has shown that asynchronous communication channels can lead to efficiency of resource utilization, a less disruptive working environment, and greater collaboration between healthcare professionals. Alongside this, it also leads to improved clinical workflow, which is associated with reduced clinical errors and reduced patient length of stay. So to conclude, our study has showed that asynchronous communication methods such as Medic Bleep has positive effects on task completion, workflow, and quality of work life. And we know that an efficient workflow is associated with reduced patient length of stay and increased patient safety outcomes. Therefore, using asynchronous communication platforms can have a positive impact. Thank you very much for listening to our presentation. I do hope you've enjoyed it. And if you do have any other questions or comments, do add them as a comment below, and we will be more than happy to respond. Thank you.